Hello, everybody. We're going to start in just a few minutes. Remember, you can ask me any questions in the chat. That means anything from heavy metals, Lyme disease, co-infections, Babesia, Bartonella, molds, mycotoxins, what tests are the best to use, what treatments are the best to use, all that good, those kind of questions. I'll be happy to answer them, always based on published medical facts and medical evidence, not on opinion or Dr. Google, but the real stuff. By the way, just as interesting facts, 80% of diseases are transmitted by touch. Okay. For example, smartphones can carry more than 30,000 bacteria. And what do you do about this? Hand washing, but it has to be 15 seconds or more, because every person's hand has approximately at least 3,000. Now, if your hands are damp, they spread 1,000 times more bacteria than dry hands. So on the average dollar bill, whether it's $1, $10, or whatever, $20, etc., there's actually 26,000, at least 26,000 live bacteria. And by the way, if you're in front of a computer, the keyboard contains more bacteria than a toilet seat. Just thought you'd be interested in these facts about bacteria. Next month, I'll be speaking in Houston at the conference of the Age Management Medical Association. And I'll be giving a half-day course on molds, mycotoxins, Lyme, SIBO, etc. This will be in Houston. And that'll be the weekend of the 19, 20, 21, and 22 of October. There's all kinds of ways you can clean and disinfect your phone, your keyboard, and other things in the kitchen, etc. A very respected doctor and friend of mine uses Young Living's Thieves household cleaner. Just to kind of let you know. Thank you for that recommendation. All right, let's give it a go now. Okay. So this is what I do. I'm the editor-in-chief of these 4 medical journals. I'm the reviewer for the Journal of Immunology Research and the Journal of Pharmaceutical Research International. I'm on the editorial of various journals, et cetera, et cetera. So, and how do you solve these medical problems caused by toxins? Not only mycotoxins, but any kind of toxin, is you detect the cause. Some people have high levels of mercury. Well, where does that come from? Believe it or not, fish, seafood. Not food from fish from rivers or lakes, but from seafood. So you detect the cause, and then you remove the cause, and you repair the damage, and the patient is well again. Here's this big medical secret that I'm going to share with you, because I have people send me all kinds of many emails every day. It takes about 4 hours of my time to answer all the emails every day, 7 days a week. And they've been sick for this long. They've had all kinds of testing. They've had all kinds of treatment. Years go by and they're still sick, and they've spent not thousands of dollars, tens of thousands of dollars. So here's the big medical secret. If you have the right diagnosis and the right treatment, the patient is well, becomes well. They're fine. They go about their life again. If you've got the wrong diagnosis and or the wrong treatment, the patient stays sick and ill and feels bad for months and years. Obviously, it's no big secret, but a lot of people go back to the same provider, and they keep using different tests and different treatments, and nothing works. Have you been there? Well, let me tell you, I'll show you how to get out of that. Here's a healthy brain on the left. This is a SPECT scan. It's single photon emission computerized tomography. And on the right is toxic brain scan. There's a, in the chat, uses shots called BCG vaccine and interferon A oral shots. How is this supposed to work for mold illness? Well, this is what is called far out there, with no medical evidence that it has any effect on molds or mycotoxins. So you can see the difference between a healthy brain SPECT scan and a toxic brain scan. Vastly different. So let me bring up some points for you. This is different brain regions. All parts, the frontal cortex, which is in your forehead, cerebral hemisphere, the hippocampus, choroid plexus. In this study published 8 years ago, in patients who had died of Alzheimer's disease, and this was at autopsy, showed that all of them had fungi, molds in all parts of the brain and in their blood. Something that I've discussed many times. You can watch my webinars on YouTube. Go to the MyMycoLab channel, MyMyCO Lab channel, and you'll see them there. Here's another one on children with ASD, autism spectrum disorder. This is a study published in 2018, 5 years ago, from Tufts University School of Medicine. They did 87 urine mycotoxins, and there was no singular mycotoxin or group of mycotoxins that was associated with children. However, when they did IgG and IgE levels, those were a more reliable index of long-term exposure. So do the blood IgG and IgE levels in people who have been diagnosed, patients who have been diagnosed with autism. Here's another comment. Friend was on cholestyramine for 2 years and is no better. Of course not. The only studies done on these binders like cholestyramine and all these others, and I'll show you exactly what I'm talking about, that's been published in medical studies. These don't work in humans. They may work in sheep, rabbits, chickens, pigs, but frankly, I don't see any of those in my medical practice, nor have I ever. I always see humans. So there you go. Here's another one. Mold in the cerebrospinal fluid. You know, when they do a spinal tap, that's what they're getting, cerebrospinal fluid. And brain tissue from patients with amyotrophic lateral sclerosis. This is also known as Lou Gehrig's disease. Compelling evidence of fungal infection in these patients analyzed. Again, showing you what the truth is. Other studies have shown that 5% more or less of all patients with Lou Gehrig's disease, amyotrophic lateral sclerosis, are due to genetic components. The other 95% from molds and mycotoxins. So again, first and foremost for treatment, the first rule of toxicology, get the patient away from the toxin or the toxin away from the patient. Please make sure that your patients are not exposed to any more molds. Otherwise, nothing will change. They will keep getting sick no matter what treatment you may give them. I use itraconazole. People say to me, oh my God, that's going to affect my liver, my heart, my this, my that, and the other. Okay, that's Dr. Google. How about if you go to published studies? This is a 6-year-old study. Itraconazole, also known as Sporanox, is a common antifungal agent that was developed in the 1980s. It has been in clinical use for 35 years with an established safety record. Now, 6 years later, it's 41 years. Okay. What about itraconazole causing brain damage? There's no evidence at all about brain damage from itraconazole. It's being used for anti-cancer medication. You see the top two pictures, the one on the left and on the right is after 59 days, 2 months of itraconazole. You can see this tumor, this huge tumor, just regressing. Here's another one. This is in patients with cancer. You see the one on the left, on the bottom left, and look at it 2 months later, okay? Can you use Sporanox safely for 1 year or more? I've never used it for 1 year. I use it for 6 months on the average, sometimes a little less, sometimes a little more. And I've, in 32 years, more than 100 published studies that I have chapters in medical textbooks as well. All are basically well after that much treatment. There's a comment that many of Shoemaker's patients are still sick 10 to 20 years later. I have in the emails that I get every day, this is what I hear. It doesn't work. Well, it does not cause brain damage. On the contrary. So, by the way, sorry about that. COVID-19 treatment. Possible role of itraconazole as a new therapeutic option. You know what they're saying? Well, they're saying that because during COVID, people stayed at home, didn't go out anywhere, and their home was probably had mold in it, that long COVID is due to molds, not anything else. Okay. So here's another. Itraconazole is life-changing for so many of the people I'm fortunate to work with. People who can only eat several foods, yet because of mast cell issues and leaky gut and SIBO are being healed by taking itraconazole and starting at a very slow and low dose and working slowly up. Congratulations for helping so many people. Here's another study, and again, you can read the study. This is from 2021, a couple years ago. One of the toxins, T2 toxin, is able to cross the blood-brain barrier and accumulate in the brain. Gliotoxin toxicity increases in the presence of glutathione. Yet so many providers, the first thing they do, they stick a needle in your arm and give you intravenous glutathione. Don't do it. Here's the medical evidence and research. Tell them to give you a study and hand it into your hand. Here's the study I'm giving you. And this is the medical evidence. The other one is people get fluconazole. Fluconazole, there's two types of molds. There's single cell molds and multiple cell molds. And the single cell molds are all yeasts. One of them, the most common one, is Candida, one of the most common ones. And yes, fluconazole will treat the single cell mold like Candida. It does not affect multiple cell molds. You need itraconazole, brand name is Sporanox, because that is effective against both single cell and multiple cell molds like Aspergillus, Stachybotrys, Penicillium, Cladosporium, Fusarium, etc. How about these famous mold podcasters saying all you have to do is live outside in a tent in the desert? They say no doctor treatment is necessary, and it's a very famous mold podcast on the internet. Well, I beg to differ. If they can prove it in a published study, that's one thing, but they can't. They cannot. That does not happen. Who's going to go live? What about if they live there's a mom, dad, and 5 kids in a moldy home? They're going to go live in a desert? Please. Why not the moon? By the way, speaking of molds, do you know that the space station has molds? It's in a published study. Here's SIBO. Look at this patient. Look at her abdomen. She's a young woman. Look at her before she took itraconazole and 3 months later during treatment with itraconazole. Binders rely on the absorption of mycotoxins from the gut, preventing it from getting in the bloodstream. That's the theory. Included are kaolinite, clays, activated charcoal, zeolite, bentonite, etc., etc. They only neutralize one, aflatoxin, which is very rare indoors. And here's the study it showed. It was published 4 years ago. They are ineffective in all other mycotoxins. On top of that, they also bind vital vitamins as well as macro and micro elements, zinc, magnesium, the B vitamins, etc. So when they talk binders, they don't know what they're doing. They think they know because they rely on Dr. Google, which is opinion. What would I use? I'm being asked, what would I use for gliotoxins? Would you use propulmonan? No. The treatment for mycotoxins is well established and has been for about 25 years in published studies. It's itraconazole and certain supplements that help the body build itself back up. It takes 6 months and the person is well. There's no studies on this propulmonan showing any effect on gliotoxin. By the way, gliotoxin is known to cause MS, multiple sclerosis. And I've been fortunate enough as a doctor to treat many, many, many patients over the last 30 some odd years with MS who within 6-7 months are totally well. They have their life back. They're doing what they want. So what about urine testing? Why is it not accurate, nor is it helpful? Here's a study done 2 years ago by Dr. Frey and his group that showed that in milk, the kind you buy at the at the store, grocery store, at the supermarket, etc., about 91% of all the milk had at least one mycotoxin. 30% had 2 to 4. But because these levels are below TDI, tolerable daily intake, they're easily excreted in urine. It's parts per billion. Okay, they just, like all things, we use urine as an excretion. We get rid of things through the urine. Okay, and so, for example, one of the labs tests for mycotoxin metabolites. What that means is they don't test for the mycotoxin itself. They test for the metabolites, and they always find ochratoxin. Ochratoxin cannot be excreted through the kidneys. So the other part of that is that if you had, if you go out tomorrow and have lunch and eat some asparagus, that asparagus is, your urine is going to smell of asparagus for the next few hours. Well, why? Because that's the metabolite of asparagus. And that's what they test for in urine. Question is, can I suggest what detox meds to take for someone who has the MTHFR mutation? I'm very familiar with that mutation. About 7 years ago, I helped a lab set up the testing for that. And I worked with a PhD in genetics from Heidelberg University in Germany, and I sat with him every day and learned a lot from him. If you go to either the MyMycoLab.com website and click at the top on video, watch my video on treatment, or you can watch it also if you go on the MyMycoLab channel on YouTube, and you can watch it. Here we go for flaws in the urine test. This is from a study published a year ago. I'm getting a question. What is the validity, Dr. Shoemaker's Genie test? My doctor told me not to buy junk tests off the internet. Your doctor's absolutely correct. That's another junk test. It is absolutely worthless. It has no place in medicine or in science. Getting back to what you're seeing on your screen now. This study said, and I'm quoting, the variability of mycotoxin concentration in urine and its volume based on daily intake. So when you drink, when your urine depends on how much fluid you drink, okay? So some days you may drink more, some days less. Some days it's hot and you sweat more, and so you have not quite as much urine, et cetera, et cetera. So they're saying, because the volume is based on daily intake, it demands urine sampling at different time points during the day, and the normalization of results with creatinine concentration. The inter-individual comparison of mycotoxin is challenging because various factors such as gender, age, diet, muscle mass can influence that. That's why it's not a reliable test. In the same journal study, which is quoted down on your screen below, the analytical validation of a direct competitive ELISA for multiple mycotoxin detection in urine serum. ELISA test is the test that is done by MyMycoLab for 12 different mycotoxins. The ELISA method to detect mycotoxins in human serum comes with significant accuracy, precision, and specificity. So, there's another comment. This is great information. I was not aware that there was medical-based science on this topic. My friend wants to see me to see this Dr. whoever, I'm not going to mention his name, in New York City for mold, but he doesn't know anything about Sporanox and said it would give brain damage. Don't go see him. I mean, honestly, if with all the medical published studies, do you know how many studies there are on testing molds and mycotoxins in serum? As of this morning, there was 1,032 studies. Okay, not 5 or 6, over 1,000. Okay, so base yourself on what is known in medicine. And I can tell you, I've trained many doctors. One of them is currently watching with us this tea time, and she's treated hundreds and hundreds of patients successfully. They're well now. Okay, so let me tell you about ochratoxin as urine, because this one lab finds it every time in urine. Well, ochratoxin is absorbed from the stomach and the jejunum. The jejunum is the first part of the small intestine. Albumin is the principal protein of the body, and it binds ochratoxin with unusually high affinity. 99.8% of ochratoxin is attached or bound to albumin. And it's reabsorbed from practically any part of the nephron in the kidney by both active and passive transport and by passive diffusion. Active transport and passive diffusion. Due to this strong albumin binding of ochratoxin, its elimination by glomerular infiltration is negligible. That means through the kidney. This was published in 2016. It's not new, and it's been known since at least 2016. So if you want more information, just email me. If you want a patient questionnaire, if you want this study that was published a year ago, molds, mycotoxins, the brain, the gut, and misconceptions, let me know. Lyme disease and mycotoxicosis or mycotoxin disease. How do you differentiate between one and the other? By the way, that study on Lyme and mycotoxins was published in the summer of 2019, 4 years ago. And in 2020, I was informed that that study was one of the 10 top studies read in 2019 of all the journals. Okay, and I'm getting another comment here. Are there any labs one needs to get done if you use Sporanox? Is it dangerous to take long-term like diflucan? Well, diflucan is not going to touch the majority of molds that make mycotoxins. Okay, it's really for like yeast infections and in women, etc. It's not a useful medication, and I'm going to give you this fluconazole. This is diflucan. Okay, doesn't touch the major molds. You need the Sporanox. Okay. So as far as itraconazole or Sporanox, the same thing. Itraconazole is the generic name. Sporanox is the brand name. You can take it. As a matter of fact, there's studies that show that Sporanox given to patients who are in liver failure and are on kidney dialysis and on the list for kidney transplant can safely take it. Okay. I think people who have Lyme really have mold illness. Let me explain that to you. There's a study done, and I did another webinar on this last month. A study in Germany took the 18 specialties of medicine: cardiology, pediatrics, internal medicine, nephrology, et cetera, and all the doctors who did Lyme disease and all the specialty doctors, the heads of the specialty organizations, and came up with a consensus on mold testing and mold and Lyme testing and mycotoxin testing. And they showed all the tests are absolutely useless to diagnose Lyme, and they put it in an actual box so that you can read it. And they then sent this consensus to the Austrian Medical Society and asked them to review it and add, change, or make comments. Well, guess what? Then when they all the Austrian doctors and German doctors agreed for the signs, symptoms, diagnostic testing, and treatment for Lyme, chronic Lyme, they then sent this to the Swiss to see if the Swiss doctors would agree. When all three countries, which are known for precision and thoroughness, they said there's only these tests which are valid, and treatment is anywhere for 14 to 21 days. And if in 21 days the patient is not well, go look for some other disease. And what did they suggest? Mycotoxins. Here's a question regarding TGF-beta 1, MMP9, osmolality, VGF, MSH, etc. for testing. Why is this not an accurate way to test for mycotoxins? There's no evidence they have anything to do with mycotoxins. There's no published evidence. There's no studies. There's nothing that show this to see if the Swiss doctors would agree. When all three countries, which are known for precision and thoroughness, they said there's only these tests which are valid, and treatment is anywhere for 14 to 21 days. And if in 21 days the patient is not well, go look for some other disease. And what did they suggest? Mycotoxins. Here's a question regarding TGF-beta 1, MMP9, osmolality, VGF, MSH, etc. for testing. Why is this not an accurate way to test for mycotoxins? There's no evidence they have anything to do with mycotoxins. There's no published evidence. There's no studies. There's nothing that show this. This is only Richie Shoemaker and his followers that say this, and it's only on Dr. Google. You can't find it in medicine. It doesn't exist. Okay? That's their flawed thinking and trying to convince you. There's the VCS test, the visual one. Has no evidence that that has anything to do with molds or mycotoxins. But a lot of people believe what they read on Dr. Google. Well, it's wrong. It's not the correct test. So here is the most accurate and precise test for mycotoxin. It's antibodies. Okay, and as I showed you in this publication, the ELISA method to detect mycotoxins in human serum comes with significant accuracy, precision, and specificity. And this was published in the medical journal Toxins, based in Basel, Switzerland, October, 11 months ago. Please add any questions. Lyme, molds, mycotoxins, heavy metals, Marcons. That's another one that's a total invention. Doesn't exist. It's an invention. So, unfortunately, these inventions have spread throughout the internet with no evidence. Being asked, what are my thoughts on Marcons? I just gave them to you. And it says, my friend who sees the Shoemaker doctor keeps putting all these sprays up his nose. I told him he's going to destroy his sinuses. How can these doctors keep saying put a spray up your nose for months and years as a patient? This is very scary. Absolutely, because it's not supposed to happen. You shouldn't. I mean, Marcons does not exist. It's a myth spread through the internet. There's no medical evidence that it helps in any way whatsoever. Again, please go to the YouTube channel for MyMycoLab, MyMyco Lab, and I've got 40 webinars on testing, on treatment, on what tests that work, what tests don't work, etc. And there's the one that I did from last month on Lyme that shows you which tests work for Lyme and which don't. For example, people are being treated because their tests show Babesia, but those tests are not valid tests. The studies have showed those are not tests that have any validity. Do you know how often is actually in Babesia in the population? It's 0.0004%. So it's tiny. But people do this test. The test says this. These providers don't check the patient. They just treat the test results. They don't treat the patient. That's not how you practice. So you practice medicine by examining the patient and getting a good medical history. The medical history usually gives you the answer, not the test. And these tests, again, are so flawed for Lyme. There's only one laboratory in the United States that has a patented test for Lyme and co-infections. That test is actually, that lab is known as Immunosciences Lab. By the way, many of you may or may not be familiar with what are known as predator medical journals. And I just received an email from regarding them. These are basically journals that are fake. And if you and I decide to write an article that the earth is flat, if we give them enough money, they'll publish it. Okay? So as a result, you can imagine that there's these people like Shoemaker and his crowd. They publish in these journals because they can't publish in a real medical journal. So they publish in these predator journals. Look up in Google, if you like, even predator journals. You'll see what I mean. Here's another chat, and it says, I've seen several people say they had Babesia and had terrible night sweats. They left their homes and all their sweats went away. They were all being treated by this doctor in New York who's famous for treating Lyme. And the comment is, he is a crook and should be in jail for lying to people saying they have Babesia. I'm so glad you mentioned that, Dr. Campbell, about Babesia. Yes, unfortunately, that's Babesia, but it happens with Bartonella, Marcons, and all the others. Again, I started this a long time ago. I'm an old guy, and I may ask, what is my opinion on using ivermectin for Babesia or for chronic Bartonella? Again, these are bacteria. Have you ever heard of chronic staph infection? No. Why? Because antibiotics get rid of it. Have you ever heard of chronic strep? No, because it doesn't exist, because you take the antibiotic. Can you imagine being a kid having strep throat and it becomes chronic? Have you ever heard of that? No. So there's no such thing as chronic this and chronic co-infections. Those are tests that are flawed, usually from labs that are using antiquated testing equipment and methods because they can make a lot of money. And I know the names, but I'm not going to mention them. Remember, you really want to know if you have Babesia or Bartonella or Lyme or ehrlichiosis or any of these. Do the test at Immunosciences Laboratories in Los Angeles. Their test is so good, it's been patented. None of the other labs that do Lyme and co-infections have a patented test. Okay, so use the real stuff. Use the best, because people deserve. This is their health. This is a precious gift. And anyone who's been sick for a while knows how precious that gift is. Don't be led by these people on the internet who have no clue. By the way, go to my website, andrewcampbellmd.com, okay? And you'll see. Here's New York's, the state of New York is extremely problematic in the area of mold and mycotoxins, including getting the proper testing. But there are ways around it. Absolutely. Absolutely. MyMycoLab gets serum from the world, except for North Korea. But the lab gets serum from Cambodia, all over Latin America, Canada, all over Europe, the Middle East, Dubai, Israel, India, certain countries, Africa, Egypt, from all of Australia, New Zealand. Yes, you can get around it in New York. You have to do it legally, but you can. Dr. Bill Ray and Dr. Lieberman are famous for doing this provocation neutralization for mold illness. I don't know anyone who got better from this. I knew the late Bill Ray very well. I met him probably about 35 years ago when we were both dealing with patients who had breast implant illness. And he believed in that. That was his method, and he had some success. I don't know, although I met Dr. Lieberman at conferences, I don't know what his success rate is. I do know what Dr. Ray's success rate is because he published it. He was more famous for doing multiple chemical sensitivities, which was what he developed as a diagnosis. He was the father of multiple chemical sensitivities, and I admire him for that. The other question here is, after handling mycotoxins, what tests can be done that are reliable for verifying mercury toxicity? One, NBMI, which is Erminex, gets approved through the FDA. What test should your doctor need to get done to be able to prescribe it? This is for persons who had verified mercury exposure with amalgam fillings. Yes, you get it. As I mentioned before, you get it from seafood, especially large fish. And let me just give you the large fish, and I actually have a list of these fish. I'm talking bluefish, crab, grouper, mackerel, marlin, orange roughy, salmon, sea bass, shark, swordfish, tilefish, tuna, etc. And I can tell you that Dr. Vrzdani did a study on Alzheimer and tuna, and he compared, he actually did the study with tuna from, let's say, sushi type tuna and tuna in a can, showing how they cause Alzheimer's. So just to let you know. The best test I know for mercury toxicity is DDI, David I. That's Doctors Data Inc. in Chicago. Okay, here's another question. If one has chronic inflamed sinuses and a good negative home mold inspection, what kind of tests can be done to confirm fungal colonization? My ENT said fungal cultures are not very accurate. However, she's not sure what other tests to do. All right, so let's take this problem with sinuses. Dr. Ponikow, chairman of the Department of Ear, Nose, and Throat Surgery at the Mayo Clinic, took 210 patients who had chronic sinusitis to the operating room, cleaned out their sinuses, and sent what he cleaned out to the laboratory for identification. 96% said mold. He actually petitioned that the term chronic sinusitis be changed to chronic fungal sinusitis, okay? So he proposed a treatment of two medications. One is itraconazole, which we've discussed here today, and the other is amphotericin B in a nasal spray in a 0.03% solution, and you use both for several months until it clears up. Since that study was published, there's been a number of other studies that have come out showing that this is the best treatment for mold in the sinuses of people causing chronic sinusitis. Fungal cultures in the nose are highly inaccurate because they don't live in the nasal passages. They get deep in the sinuses, and you can't reach sinuses with a swab. Here's another comment. I have asked over 20 people that I know personally who have taken cholestyramine. None of them said it cured them. Some said it made them worse. Why is it that a protocol that does not work keeps being pushed like this? My PCP said that old cholesterol medication wasn't even good for cholesterol. All these doctors want to make money, and for what? Well, as I've mentioned before, in all the emails I get every day, I get this kind of email all the time. And this is from people who've been on cholestyramine for 1 year, 2 years, 4 years, 5 years, or cholestyramine and some other binder and this and that, and the Shoemaker treatment, so on and so forth, okay? Cholestyramine, okay, so just so that you know my background. Before I did clinical immunology and then toxicology, I was a surgeon. And when you take the gallbladder out, because it's got stones or infected or whatever, bile that's made in the liver doesn't have this sac to accumulate in, okay? So it goes directly into the gut and can cause discomfort and diarrhea, etc. And so in the late 70s, kind of dating myself here, they came out with cholestyramine. It's meant to bind bile, not cholesterol, not anything else. Okay? It doesn't work. It's not meant to lower cholesterol to begin with. It wasn't developed for that purpose. It was developed for the purpose of binding bile salts, which can irritate the gut. And unfortunately, I get a lot of emails from patients who have spent tens of thousands of dollars and they're still sick. They spent it on worthless tests, unvalidated tests, worthless treatments. It is very unfortunate. Another question. What's worse is this doctor in Arizona says that to take 9 grams of charcoal for 10 or plus years for brain damage. I know that doctor. I'm not going to say his name, but I know him. And he's wrong. And another question from another doctor here. Why do you recommend that people take supplements, in parentheses, magnesium, vitamin D, etc., in addition to itraconazole? Couldn't they get better by killing off the mold? No, because mycotoxins damage, the way they kill cells is they go into the cells, cause dysregulation of the mitochondria, and when the mitochondria becomes dysregulated, that cell dies. Then they go on to another cell and do this again and again and again. So you've got to support the cells. Every magnesium, facts and in medicine show that most people are deficient for magnesium. Why? Which is a valid question. Why take magnesium? Well, we used to drink water from wells. All thousands and thousands of generations back to Adam, we got water from wells. And in wells, which is deep inside the earth, we got all kinds of minerals with that. Today, people grab a plastic bottle and drink that. Okay, it has nothing in it except for H2O, water. It has no minerals, nothing. Okay, so you're not getting things like magnesium. Secondly, studies show that 80 to 85% of the population are actually vitamin D3 deficient. Why? That's because we spend 90 to 95% of our time indoors. And what I mean by indoors, some indoors also means in a car traveling to and from places. So, having said that, this is why you need the supplements to help your body get rid of these, not only the itraconazole. Okay, here's another one. I still have all my fillings, I'm assuming dental, and all my teeth after many dentists insisted I needed fillings removed, root canals and removals. All my dental issues were from molds and mycotoxins. Very true. I've seen that a lot and heard that a lot. Mainstream testing is greatly flawed. Mine were all negative. A swab test from immunolytic correlated perfectly with the mycotoxins in the blood. Okay. Here's another one on inflamed sinuses. And a good negative home mold inspection. What kind of tests can be done to confirm fungal colonization? You do that by doing the test that is here. My ENT said fungal cultures are not very accurate. No, they're very inaccurate. And just tell her to do this test. And by the way, when she does the test or you do the test, we can do a Zoom call and go over it. And yeah, you should check your workplace, and sometimes it's your vehicle. Another comment, I'm so glad I attended this tonight. Dr. Whatever, and wanted $800 for this first appointment, as was going to give me cholestyramine, and wanted another $150 for a Marcon's test. Don't do it. It's worthless. And good job in doing your research. True. Very, very true. He wanted to do this test in something called actinomyces. He said it would have to clean my entire place from top to bottom with a fantastic spray. Well, Shoemaker has to keep making money, and so he has to keep developing new things to make more money. So now he's saying it's actinomyces, not mold or mycotoxins. Anyway, it's a bunch of baloney. What's my opinion of Haven Biopharma? Well, let me help you. And here's another comment. Actinomyces is a total scam. I agree. So I get every so often a company that makes filters HEPA filters and all kinds of other filters, and things that are supposed to, sprays or various other things that are supposed to remove molds, etc. And I always ask them, thank you for sending me the email. Please send me whatever medical evidence you have that this actually works. And they respond, they don't have it. So they want me to, to mention their product either on in my tea times with you, and also my webinars on my website. I'm so sorry. Unless you show me evidence, I can't endorse you. I can't endorse a product that your opinion and your company's opinion is it works. I remember when smoking was okay, cigarettes. So, people smoked cigarettes on the elevator. My gosh. And on planes and in the office, etc., because it was okay. Any other questions? So about this Fogger thing, I don't have an opinion. I don't know. I can't say if it's works or doesn't work. I don't have any evidence. Can pets be tested or treated for mycotoxins? I believe so. I'm not a veterinarian. I know I have a good friend who's a veterinarian. Her husband's a dentist. He's a friend of mine, and she's a veterinarian. And she said they actually get trained about this because farm animals may suffer from mycotoxins from their feed. So I would ask your veterinarian about that. And again, find a good one, which is always the hardest thing to do. Find a good doctor, or find a good veterinarian, or find a good dentist. You just can't open. In the old days, you'd open the yellow pages. Today, you open the internet. You have to really ask other people what they think of or who they use as a vet. Hopefully that may work. All righty, folks. Well, thank you for being here. Remember, next week, I'll be doing another webinar. Fascinating stuff. If you want any of this, let me know. I'll be happy to help you in any way I can if you email me. I got a couple of questions here. Various companies try to post on my page, and I always ask for the science, but it's never real peer-reviewed. Very true. Here's any move on to getting insurance to cover the MyMycoLab test yet, at least for folks in the US. Well, I can tell you, not only in the US, I spoke yesterday to a group of doctors in Berlin who are trying to pass that in Germany. And on last Friday, I spoke to a group of doctors in Prague who have clinics throughout the Czech Republic and Switzerland. And they're trying to do the same thing. It's an uphill battle because insurance companies don't want to pay money for anything to get away from paying money. Another comment was, I was on the website of this Dr. Shoemaker. I can't understand why any of this, and there's no patient testimonial. I found out, well, don't pay any attention about license because that really has nothing to do. Do you think that Dr. Boyd Haley's mercury chelator will be successful? No idea until I don't see the evidence. Can a blood draw be done for a pet using MyMycoLab test? No, it's only good for humans. Although, if you think as a doctor, humans are mammals, doctors are mammals, but again, we don't have the testing for animals. Would that not work to detect in the blood of a pet too? I wish it would. I get asked this by, and I love pets. I have my own pets, part of our family, etc. And I would love to have a test. I get asked this about horses as well, and so on and so forth. My thoughts on HLA testing. That's a total scam. So the HLA testing says that 25% of Americans have this gene. So 25% of the US population would make it about 82 million people would have this gene. Yet there isn't a single study on it, a publication. There's over 112 million studies in PubMed. Not one of them on this HLA link and molds. Nothing. Okay. I can tell you that it's total scam because think about it. There's a disease known as diabetes that affects 30 million Americans. Everybody's heard about it. Yet this other one that's supposed to affect 80 plus million Americans, nobody's heard about it in medicine. Doesn't make sense. Very sad here. After having lost my fiance and cat to aspergillosis, I had to ask for others. Yes, I'm so sorry to hear that. By the way, MyMycoLab is doing studies with various universities, both here, university medical centers, both here in the United States and in other countries in Europe. That's evidence. There isn't a single medical university anywhere on the planet that's doing any urine testing studies. Any other questions? I'd be happy to address. Otherwise, it's now 1 minute past the hour. Thank you again. I'm very grateful for you having listened and I do this for educational purposes only. I don't want any money. All righty, folks. Well, take care, everybody. Have a great rest of the week. All the best to you.